States. Mixed messages on the coronavirus and what the president calls a cure. It's leading to confusion as we head into the critical fall-winter months. KPIX5's Len Ramirez joining us from San Jose with more on that. Len?
Well, people are obviously listening when the President of the United States speaks. They're also watching him as he sometimes downplays the effects of the pandemic. They're also listening and watching what the experts say, the scientists, and they are the ones who are now saying that we could be headed for another dangerous spike this fall and winter.
We're rounding the turn on the pandemic.
With President Trump claiming on the Rush Limbaugh show that the antibody treatment he was given is the silver bullet to defeating the coronavirus.
I'm telling you, we have a cure. More than just a therapeutic, we have a cure.
And with cases still rising and patients dying in much of the country, people have reason to be confused.
There's a lot of mixed messages going on around the world, especially with different platforms online and in social media. Absolutely. I think it's something that needs to be taken seriously.
Santa Clara County Executive Dr. Jeff Smith says Trump's treatment, however potentially promising, is only about a week old and a lot can still happen.
And so at this point, I think it would be premature to say he's cured. The reality, I believe, is that he's getting such high doses of steroids that he's has a little bit of steroid mania.
Santa Clara County's case positivity rate has been dropping, now averaging 1.7%, and other signs are trending in the right direction. Smith says the county could move from a red to a less restrictive orange tier next week, but officials are urging the public to keep up distancing and mask wearing because more difficult times lie in the months ahead.
I'm very concerned that there will come a spike in the case count and the deaths as we move closer to November and December in the winter time periods, because people will go inside, they'll be with family, they won't follow their masking priorities because they'll feel safe, and the virus will reinstitute itself like it is doing in New York.
So, Len, do the county leaders there believe there is going to be the second or even a third wave?
Yeah, they're kind of modeling what they've seen in previous pandemics, including the 1918 pandemic, when there were three very distinct spikes. So we could be, depending on how you're counting it, either in the second or maybe headed towards a third spike. The real big question mark is whether or not there will be a vaccine and whether or not some of these experimental treatments that the president is getting will be more promising for the greater public, and whether or not those will be available as we move into the winter and then in the spring.
Absolutely. Can they get them out there? All right, Len Ramirez, thanks so much.